Bismillahirrahmanirrahim. Today we are going to start humerus. It is the bone of the arm. It is the longest bone of the upper limb. So the humerus has two ends, the upper end, the lower end, and a shaft. So first of all, we'll discuss how we'll determine the side to which this bone belongs. It will find out the side determination by 3 points. First of all, the upper end is rounded and it forms the head. The lower end is expanded from side to side and flattened before backward. The number 2 point is the head is directed medially, upward and backwards. The third point is the lesser tubercle is an elevation in the front of the upper end and it is limited laterally by the floor of the bicipital groove. The features of the humerus bone, it has two ends, the upper end, the lower end, and the shaft. First of all, we will discuss the upper end. The upper end has a head which is directed upwards, medially, and the backwards, and it articulates with the glenoid cavity of the scapula. So this is how they articulates, and it is much larger than the glenoid cavity of scapula. It articulates with glenoid cavity of scapula and forms the shoulder joint. The head is about 1/3 of a sphere. Now the line separating the head from the upper end is the anatomical line. This is the anatomical neck. It is called the anatomical neck. The lesser, there is an elevation in the front of the upper end. It is called the lesser tubercle. Then there is an elevation on the lateral side of the upper end. It is called the greater tubercle. The greater tubercle, the posterior aspect of the greater tubercle has three impressions, as we see there: the upper, middle, and the lower impression. These are present on the posterior aspect of the greater tubercle. Now there is a intertubercular sulcus or bicipital groove. It separates from the lesser tubercle from the greater tubercle. The downward prolongations of these lesser and greater tubercles makes the medial and the lateral lips of the intertubercular sulcus. It is also called as bicipital groove. The narrow line which separates the upper end from the shaft, it is called the surgical neck. So now the shaft of the humerus. The shaft is rounded in the upper half and it is a triangular in its lower half. So it is rounded in the upper and triangular in the lower. It has three borders and three surfaces. First of all, the borders. The anterior border, the anterior border, the lateral border, and the medial border. The anterior border starts from the lateral lip of the intertubercular sulcus or the bicipital groove, and in its middle part it forms the anterior aspect of the deltoid tuberosity, and in the lower part it is smooth and rounded. So this is the anterior border from lateral lip of bicipital groove, deltoid tuberosity, anterior aspect, and rounded. The lateral border is prominent only at the lower end and it forms the lateral supracondylar ridge. It is barely traceable and then it projects upwards to the posterior aspect of the greater tubercle. So this is the lateral border. The medial border starts from the medial lip of the intertubercular sulcus and it projects downward to the medial supracondylar ridge. This is called the medial border. Three borders: anterior border, lateral border, and the medial border. Now it has three surfaces present. The three surfaces are the anterolateral surface, anteromedial surface, and the posterior surface. The anterolateral surface is present between the anterior border and the lateral border. This surface has a V-shaped deltoid tuberosity. This is the V-shaped deltoid tuberosity in its upper part, and behind the deltoid tuberosity is a groove called as radial groove. The deltoid tuberosity and behind it is the radial groove. This is the anterolateral surface. The anteromedial surface lies between the anterior border and the medial border. The upper one third is narrow and it forms the floor of the bicipital groove. And in its below the middle of the anteromedial surface, there is a nutrient foramen. It is seen near the medial border. The nutrient foramen present near the medial border below its middle part. Now the posterior surface. The posterior surface is present between the medial border and the lateral border. In its upper part there is a oblique ridge, and below the middle one third is crossed by the radial groove. So the shaft of the humerus has three borders. The anterior border from the lateral lip of the bicipital groove downwards, and the lateral border, the lateral supracondylar ridge upward to the posterior aspect of the greater tuberosity, the medial border from the medial lip of the bicipital groove to the medial supracondylar ridge. The anterolateral surface has a V-shaped deltoid tuberosity, and behind this tuberosity is the radial groove. The anteromedial surface having it has upper part has floor forming the floor of the bicipital groove, and it has a nutrient foramen along the medial border. The posterior surface has a oblique ridge in its upper part, and it is crossed by the radial groove in its middle part. Now the lower end of the humerus. The lower end of the humerus is expanded, has condyles, so it is expanded from side to side and flattened before backward. The lower end has the articular surfaces and the non-articular surfaces. The articular surfaces are two. The capitulum. The capitulum is a rounded projection. It articulates with the head of the radius. The second articular surface is the trochlea. It is a pulley-shaped surface. It articulates with the trochlear notch of the ulna. Now the medial edge of the trochlea, it projects downward 6 mm more downward than the lateral edge, and this forms the formation of the carrying angle. The non-articular parts of the lower end includes are the medial epicondyle, the lateral epicondyle, the lateral supracondylar ridge, the medial supracondylar ridge, and the three fossas. First of all, the medial epicondyle is a prominent bony projection on the medial side of the lower end, and it is subcutaneous. We can easily feel it on the medial side of our elbow, as it is present subcutaneously. There is no muscle present above this bony projection. Now the lateral epicondyle is smaller than the medial epicondyle. It is on its anterolateral aspect, it has a muscular impression. The sharp lateral margin just above the lateral epicondyle, it is called the lateral supracondylar ridge. The sharp medial margin that is above the lower end of the medial epicondyle is the medial supracondylar ridge. The three fossas are coronoid fossa. It is a depression just above the trochlea. Its function is to accommodate the coronoid process of the ulna when the elbow is flexed. Now there is a radial fossa which is just above the anterior aspect of capitulum, and when the elbow is flexed, it accommodates the head of the radius. The third fossa is the olecranon fossa. It is a big depression in the posterior aspect of the trochlea, just above the posterior aspect of trochlea, and it accommodates the olecranon process of ulna when the elbow is extended. So these are the lower end has medial epicondyle, lateral epicondyle, the lateral supracondylar ridge, medial supracondylar ridge, and the coronoid fossa and radial fossa in the front, and the olecranon fossa the behind. These are the some features of humerus bone.